Speaker, and you've got to smile when the opposition, in prosecuting their argument that the government don't support Medicare, have brought the stunning exhibits from more than 40 years ago. And what we need to do is talk about some more recent history. And we talk about some more recent history when the Prime Minister was the Minister for Health. And here's a question for you. Which government added dental services to Medicare? Which government did that? It was the Howard government. Which government expanded Medicare to allied health services in the treatment of chronic disease? Who did that? Who was the health minister who expanded Medicare to introduce access for physiotherapists, for dentists, for podiatrists, for other allied health? Who did that? Who was the health minister who expanded Medicare, who improved Medicare? It was the current Prime Minister. It was the current Prime Minister. Now, when you look at Australian health, when you look at our health system, and you look at how the health of our country compares, we do pretty well. We have one of the highest life expectancies in the world for both men and women, and we see that improving. We see one of the lowest smoking rates anywhere in the world, and that's been from concerted action over the last 30 years from state and federal governments. We see vaccination rates improving, and that was something that was a very proud achievement of a former Coalition Health Minister, Michael Wooldridge, who actually saw Australia have the sort of vaccination rates we should enjoy. We've seen over the last 20 years the 5-year survival rates from cancer increase from 47%, in 30 years ago, to 66% more recently. We've seen a dramatic fall in people having a heart attack and dramatic falls in death from heart attack. And we've seen deaths from asthma and COPD death rates decrease. We've seen death from asthma and COPD dramatically decreasing over recent time as well. There's no doubt Australia has a very good primary health care system. We have a well-trained GP workforce. We have multidisciplinary care, but as good as it is, there is further room for improvement. The OECD has said even Australia, which by all standards is regarded as an efficient system and by all standards is regarded as a good health system, we still do have room for improvement in efficiency, and we have room for improvement in life expectancy. We do face a number of challenges into the future. The major challenges that I said before are how we manage chronic disease, and also what we do in terms of the coordination of healthcare, so that people with conditions that don't need to go to hospital are able to be cared for better in the community. Now, in terms of what the opposition are raising in this point, which is their opposition to what is a modest co-payment. And we have more than 100 million non-referred GP services. And it's reasonable for any insurer, especially the government, to actually say, what are we getting in return for that? Now, the opposition's approach is to say the sky will fall in. Well, the sky will fall in. It will be the end of the world as we know it. But what we have a look, when you have a look at the health system, what you see is Australia enjoys a great health system. We have a great primary health system. This government, in the past, the Coalition has shown that it is the best friend that Medicare has ever had, and this government will continue to do that by strengthening primary care and strengthening the PBS system. We need to make sure that it's sustainable into the future. We've seen growth in health expenditure, growth in PBS expenditure increase well above inflation, well above the growth of the economy in recent years. This is a modest proposal which will improve the sustainability of our health system and the challenges we face into the future.
Order.